In our last session, we discussed one of the case studies that is an insulin pump control system. And in today's session, we will be discussing a second case study that is a patient information system for mental health care. We shall have a slight look about what is a patient information system for mental health care. It is a patient information system to support mental health care is a medical information system that maintains information about patients suffering from mental health problems and the treatments that they have received. The next thing is most mental health patients do not require dedicated hospital treatment but need to attend specialist clinics regularly where they can meet a doctor who has detailed knowledge of their problems. Next is to make it easier for patients to attend. These clinics are not just run in hospitals, they may also be held in local medical practices or community centers. So, what is a patient information system for mental health care? So it is, we call it as the Mhc Pms, that is the Mental Healthcare Patient Management System. This Mhc Pms is one of the medical information system that maintains information about the patients who are suffering from mental illness. So it is called as mental healthcare patient management system, and it also consists of information about the treatment that the patient is receiving. For most of the patients, hospital treatment is not necessary because they are not in such a critical condition. So for them, it means that they need not to get admitted in the hospital and they need not to be in the hospital regularly. All the thing they have to do is to consult. They need to do is they should consult a doctor who is having a complete or a detailed knowledge about the problems. So, to make this easier for the patients, that is to attend the clinic, to attend and to consult the doctor, there are some clinics or practice centers or community centers which are also open together with the hospitals. So, to the thing is to make easier for the patients to attend and to consult the doctors. There are some clinics together with that they have the medical practitioners practice centers or community centers. So this MHC PMS, that is Mental Healthcare Patient Management System, it is an information system that is intended for use in clinics. So this MHC PMS, it makes use of the centralized database which consists of patient information. It is centralized database in the sense it is a system which consists of information regarding which consists of data regarding the patient, that is what issue from what issues the patient is suffering from, what is the disease and what is the treatment is have been undertaking, he has undergone to which of the treatment. So all these details will be maintained in a centralized database. So this MSc PMS will make use of that centralized database. Next, we shall see some of the MSc PMS goals. That is, MSc PMS is used to generate management information that allows health service managers to assess the performance against the local and the government targets. That is what they have said, to generate management information that allows health service managers to assess the performance against local and government targets is one of the MSc PMS goals. And second goal is to provide medical staff with a timely information to support the treatment of the patients. That is, a medical staff should be given a proper information about the treatment that the patient is having, that the treatment that the patient is has been undergoing. So the timely information should be given to the medical staff, and this has been one of the goal of the MSc PMS. Next, in this figure, you can see the organization of the Mhc Pms. That is, the figure shows how the Mhc Pms, that is a mental health care patient management system, is organized. You can see here several Mhc Pms local systems are connected to the Mhc Pms server, so that a patient information can be accessed through the centralized, that is a patient database. A patient database consists of the patient information. So this patient information has been exchanged between the MSc PMS server and the MSc PMS local systems. Next, we shall see the key features of the MSc PMS. That is, what are the key features, what are the main features of the mental health care patient management systems. So it mainly includes the three features, that is individual care management, and second feature is that patient monitoring can be done easily. Together with these features, administrative reporting can also be made easier. So these are the three key features of the MSc PMS. So far we have gained a knowledge about what is MSc PMS. So MSc PMS is nothing but it is one of the medical information system. So it consists of detailed information about the patients who are all suffering from the mental illness, and what are all the treatment that the patient is receiving. Next, we have seen we came to know that MSc PMS make use of a centralized database which consists of the patient information, and we have seen MSc PMS goals. What are all the goals of the medical healthcare patient management system? And we also discussed about the organization of the MHC PMS, how this MHC PMS, that is mental healthcare patient management system, has been organized. So it is having a patient management system, local systems, and which is connected to the MHC PMS server, and this server has also been connected to the patient database which consists of the information about the illness of the patient, and together with that it consists of the details about the treatment that the patient is receiving. So this information can be accessed by the MSc PMS local system through MSc PMS server. And we came to know that what are the key features of the MSc PMS system. So the key features are individual care management can be done, and patient monitoring can be done easily, and together with these features, administrative reporting can also be made easier. In next class, in next session, we shall discuss about a wilderness weather station information system. So this is one of the another case studies. We shall discuss it in the later sessions. Thank you.